Hey community, we're back and I'm Brandy B, the community MP.
And I'm Brandy G, the community NP.
And together we are
B&B, the community MPs.
So we're in our series on the urinary tract, which seems like it was forever long, but it's over now.
Yes.
And we're starting this series on STIs.
Okay, so what are STIs? What does STI mean?
Sexually transmitted infection.
So how do you get the infection?
By having sex.
Okay.
With somebody that's infected.
Okay.
Yeah. It used to be called STDs.
Yes.
So I think that's what most people still...
So is it by having unprotected sex?
Yes. Unprotected sex, oral, regular, anal.
Okay.
All of them. You can transmit STIs that way.
Okay. So we're going to break this series down. So today we're going to really focus on just talking about some of the facts about STIs and chlamydia and gonorrhea.
Yes.
And then every week we'll do a different topic on STIs. Okay.
There's plenty.
So are STIs, if you have STIs, do you have to have symptoms?
Well, you don't always have symptoms. A lot of people are asymptomatic, which is why it's spread so easy.
Okay. So I know when I was growing up, at a certain age, you have to get screened. They want to screen for STIs. So why do they screen people? Why do they want to screen people for STIs?
Well, I think that we screen primarily because, like we said, most people are asymptomatic.
Okay.
And so they continue to have sex with other people, and it gets spread to other people.
Okay.
So we just screen. That way we can catch it, even if you're not having symptoms.
Okay. All right. So that tells us, you done explain why we screen.
Yeah.
Another thing is you want to, like you said, you want to identify who has it so you can go ahead and treat.
Right.
Because some of them can lead to complications that we don't want women or men to have. So therefore, that's why it's important to get screened for STIs. Now, when do you start screening your patients?
Well, I see adolescents.
Yeah.
And I have a lot of young sexually active adolescents. So if they're sexually active, I mean, I've screened 11 and 12-year-olds, to be honest. So it just depends on the person.
Yeah. I screen anyone who's sexually active. I go ahead and screen them. Especially it's crazy because some of my older adults, like they come in wanting to be checked for STIs.
Out there getting it.
Yeah, so they want to be checked for STIs. Some of my older people.
Yeah.
I'm talking about like 80s. I'm like, oh, okay. But I go ahead and check them.
Yeah.
Okay.
So I was going to say, the other reason we screen is because once it's detected, then, we recommend for that person to go back and, however many people they slept with, their business. But
partner trace.
Yeah. Trace back and let all the other people that could have been infected know so that they can get treated as well.
Yeah. So do you do partner treatment? I remember a long time ago when I was in like nursing school, long time ago, they would just empirically treat the partner. But now I know that I recommend that the partner comes in to be seen.
Yes.
Just comes in to be seen to get treated.
Yeah, I recommend that too because who knows how many partners there are.
Yeah, I know. You're right. So some of the facts. So from the CDC website, it says that 26 million people acquire STIs, and this was in 2018. 26 million in 2018. These were the cases that were reported.
Yeah.
Was not the ones that was not reported, but these were reported. That's a lot of people with an STI.
Wrap it up.
I know.
Wrap it up.
Then it says nearly 1 in 2 incidents were acquired by people 15 to 24 years of age. So it's our younger population that really...
Because they're risky.
I know.
They're so risky.
They think they're so invincible.
Yeah, they think they're invincible. Nothing's going to happen to them.
Yes.
And I guess they just still don't have that thought process of, that there's going to be consequences or there could be consequences to their actions.
So that was the population. This was the one that really got me. They say they spent nearly $16 billion in direct medical costs resulting from STIs. In 2018, $16 billion.
Billion, not million.
Billion. That's a lot. And when I was looking at this...
And how much condoms cost?
How much? They're free.
Yeah,
because we give them out for free.
So
we give them out for free. But when I was looking at this, this was the breakdown of treating like all STIs, HIV, HPV. It was like just the treatment of all STIs. People come into the doctor. It was for the medication.
Yeah.
So it encompassed a whole lot. That's $16 billion.
Yeah.
But still, that's a lot of money, y'all.
Yeah. Because I guess treating HIV is expensive.
Mm-hmm.
But now there's so many new medications that are out to help treat. It seems like it shouldn't be that much.
It was 16
Gosh.
billion. All right. So what are the most common STIs in the United States be?
Gonorrhea and chlamydia.
Do you see a lot of that?
Yes.
All right. I do too.
And usually I see them together.
Yes.
So you can get one without getting the other, but I see a lot of people that have both.
Okay.
Do you?
I do.
Yeah.
I do. Gonorrhea and chlamydia. But I see a lot of trichomonas too, but we'll get to
too.
that one later. I see a lot of trichomonas.
Yes.
Yeah. But those are two. So let's talk about gonorrhea and chlamydia in females. What complications can occur? First of all, are females symptomatic?
Sometimes.
Okay.
Sometimes they're symptomatic. Sometimes, like we said before, both males and females can be asymptomatic. Yeah. But what was your question?
So my question was, okay, if we have a female with chlamydia and gonorrhea. Well, let me give you a scenario. So I had a patient who came in complaining of pelvic pain. Pelvic pain. She said she'd been having it for a while. Well, she was saying stomach pain, but when I pressed, it was really in her pelvic area. So I did a urine test on her to check her urine, did STI testing, and it was gonorrhea. She had both chlamydia and gonorrhea. So I lost my train of thought.
Was she having, what symptoms was she having other than?
And she was having some back pain also.
Okay.
She was having some back pain.
No discharge?
She was having discharge, but she said she always have discharge, so she didn't
really think it was new.
Really think of it was new. So I forgot what I was gonna say. I don't lost my train of thought, but that's okay. But let's go back to chlamydia and gonorrhea because I don't know.
You'll think of it.
No. What I was thinking about was why is it important that we treat, especially females, for chlamydia and gonorrhea? What could be the side effects if it goes untreated?
So one of the biggest is infertility.
Okay.
Yeah. So, but going untreated, usually, I mean, you got to go a while. But a lot of people do go well because they don't have symptoms. Yeah, so.
Pelvic inflammatory disease. I was thinking about that because I remember having a patient who I had to send to the ER because literally she was like had febrile.
Oh my God.
Yeah. So that went
on a long time.
So pelvic inflammatory disease. So the problem is with women, it can go up the GI tract, not the GI tract, the GU tract, with your urinary tract. It can go up that tract, which can cause the complications of infertility. Pelvic inflammatory disease. So that's why it's so important that they get screened and treated for this.
Yeah.
So let's talk about men.
What about them?
Sometimes they don't have any symptoms.
Yeah.
So why we
they just out here spreading their love.
So that's why it's important to get screened. But sometimes they do have symptoms.
Yeah.
But
what symptoms?
So they may have discharge from the penis, pain when they urinate.
Yes.
What else? I think that's probably it.
Yeah, and then sometimes I've had some complain of like lower abdominal pain, and rarely like testicular discomfort.
Yeah, but it can happen. Testicular problems, the prostate. Some of them, their prostate may become enlarged.
Yeah, and infected. So. And
one of the other things that they talked about was rectal pain and rectal inflammation because of anal sex for both men and women.
Yes.
That can be one of the side effects and complications. All right, so let's go through these complications again because I think we just went through them. So with women, what are some of the complications that women have, some of the symptoms that women may have?
The infection in the urinary tract.
Okay.
Cervicitis, which is like swelling of the cervix, dysuria. And what else?
But we have pain on urination. They may have pain with sex. They even may bleed between their menstrual cycles.
Yes.
That can occur also. Pelvic pain, like we said.
Rectal inflammation. That can happen in women too.
And people who are pregnant, they may have complications with their pregnancy.
Yes.
They may have preterm labor.
Yep.
Because of the infection.
And if they deliver, then they have the risk of passing the infection on to the baby. So
yes. And ocular infection.
Yes.
I recently had a kid with an ocular infection, which was a gonorrhea.
I remember that.
Ocular infection. It was horrible.
It was.
And it was crazy because it drained the mucus, like the mucus that you would see from the vaginal area or the penis was draining from the eye.
Yep.
Yes, and it was hard to treat too.
I remember that. I remember seeing your kid.
All right, so let's talk about some symptoms in men. Like you said, first of all, their urethra can be inflamed also.
Yes.
Their prostates can be inflamed, prostatitis. They can have pain with urination.
Yes.
They can go to the bathroom more frequently. Pain with ejaculation. They can have pelvic pain also. And the proctitis, which is the inflammation of the rectal area.
Yeah.
Yes.
So, and that's why it's like, you don't want to develop all of these complications. And it is embarrassing to go to the doctor and say, oh, I think I have a STI, but 64, however many people have them. So it's not like your doctor's going to be like, oh my God, judging you.
Yeah, no. I rather you come in.
Let's get you treated before you infect anybody else or before you develop any type of complications.
And one symptom I didn't mention was pharyngitis.
Oh, yeah.
I did read that from oral sex.
Yes.
They may have some type of pharyngitis from oral sex also.
Yeah.
So, so we just want you guys to wrap it up.
Could you imagine having gonorrhea or chlamydia discharge from your mouth? Oh,
yeah, so that was one of them, conjunctivitis, pharyngitis.
Yeah.
Okay. All right. So how do we treat this? How do we treat?
The treatment is easy. The treatment is basically antibiotics.
Yep.
And usually it's a short course of antibiotics. So most times you can get treated same day in the clinic.
Okay. So when we treat our patients, what should they follow after? Should they avoid having sex for a while? Should they avoid having sex with that person who may have infected them or who they may have infected?
Both. They should avoid having sex, especially with the person that they think may also be infected, because they can get reinfected.
Okay.
And then finish your course of medication before you have, sex, period, point blank.
Yes. And I always tell my patients, especially when they come in with chlamydia, gonorrhea, and I test them for all the STIs.
Yes, me too.
And when they come in with chlamydia and gonorrhea and the other ones are negative, I tell them it's a lucky call. Because just how you got chlamydia, gonorrhea, could have been HIV, could have been herpes, it could have been something that you just really can't get rid of.
Exactly. Yeah, so some of them are treatable. Yes. Some of them are not. So you just got to be safe. Yes. If you care about your health, I mean, you're going to want to have a health, like a good sexual health for the majority of your life.
Yes.
So ages 15 to 24 is the risky ages. You just got to be careful. And so parents, you got to talk to your kids, because they're like I said before, I have tested 11 and 12-year-olds and they've come back positive for gonorrhea, chlamydia, trichomonas. So whether we want to accept it or not, it's happening.
You don't want all the babies out there having sex, but
So we got to talk to them.
Yeah, but that happens.
Yes.
So that was chlamydia and gonorrhea. And so I guess we can talk about some of the symptoms, like as far as what it looks like. Yeah. Some people, they may not have any symptoms, but I noticed that with chlamydia, you may have like a thick cloudy discharge. Men may experience that. Women may experience that. Yes. And with the gonorrhea, you may have a thick discharge, but it can be yellow, green. It can vary.
That gonorrhea discharge, though.
Yeah. So it can vary. The colors can vary, yellowish, greenish. A thick discharge can occur also with both of them. So you're looking for this discharge, but everybody may not have the discharge.
Right, that's right.
So, all right.
But just be mindful. If you have green stuff coming from any of your sexual
offices, come and see me and be the community MPs, and we will take care of you. We will definitely take care of you guys.
Non-judgmental. We just want you to be healthy.
Yes.
And not spread your love. Spread your love without spreading a disease.
Yes.
Yeah.
So, all right. So that's chlamydia and gonorrhea. Anything else about chlamydia and gonorrhea that you could think of?
I think that's about it.
Okay.
But what's the disclosure?
Okay, so the disclosure is this information is for educational purposes only. It's to spark a conversation between you and your loved ones, or family members, or friends.
Yes.
It's not to replace you going to your primary care provider. Period. It's not to replace that.
Nope.
Okay? And B, tell them where they can find us at.
YouTube, Facebook, Instagram. And, last time I threw in the fact that we had an email. So if you have, questions that you don't want to share on social media platform, you can email us.
What is the community MPs
at gmail.com.
Yes.
But do subscribe to our YouTube channel.
Yes.
Share our videos. Spark these conversations.
Yes.
And
tell us what y'all want to talk about.
Yeah, for sure. Cause
I like having these conversations. Tell us what y'all want to talk about.
Yeah, because we want to cater to you guys. What information you need to know. So we assume these things you want to know, but if you just tell us, then we can just give you what you want.
Yes.
Right?
Give them what you want.
But so that's it.
Anything else?
I think that's all. But why do we do this?
Because
my gosh.
I will never forget this.
Never forget
this. Because community is our beauty.
Yes. Have a good day, y'all.
Bye.